Tonight's first extreme makeover candidate lives in the small town of Wilson, Arkansas. Karen Lindley is 44 years old and about to be married for the second time.
Pretty. That is so pretty.
I'm sorry.
Oh.
I would love to be a pretty bride. I'd love to walk in there all dutied up and looking 10 years younger.
Karen's dry sense of humor masks her true feelings about her appearance.
I've always stood back a little bit if I was in a crowd of women that I thought were prettier than me. The first thing I think when I meet somebody is, I wonder if they're looking at my nose. I've had several breast surgeries that have left me a little uneven and much smaller. I think I could look nicer, and I would like to.
Blake supports Karen's decision to have an extreme makeover, even though he won't see his fiancée until she walks down the aisle.
To be that pretty bride, I'd like to have that ooh and ah.
Karen's dream is about to come true.
You're leaving for Los Angeles.
No!
Because we're going to give you an extreme makeover and bring you home just before your wedding.
Oh, this is so exciting.
Yes.
This will be so pretty.
Yes.
24 hours later, Karen and Sandra are in Los Angeles. Karen is off to meet the first member of the extreme team, Dr. John Perlman.
Welcome to Beverly Hills.
Thank you.
Nice to meet you. Tell me how I can help you.
I have always dreamed of having a nose job.
What, is it the bump?
Yes.
Okay.
I got that from my grandmother.
In your case, I would not only want to lower the bony part of the bump, but I'll probably need to borrow some cartilage from an area that you don't need it in the septum and put what's called a strut in to keep your tip from falling back in as the bridge is lowered. Do you ever have a feeling that the skin is hanging on your eyes and affecting your vision?
Especially in the mornings.
Yeah.
Get up puppy.
Okay. Just a small bit of fatty promise more on the left than the right, at least at this point in time. And we can take that out through a little incision on the lining of your eyelid.
I've had 6 breast surgeries for fibroadenomas. I have an A and a B. I'd like them equaled out. I'd like a nice C. I don't want anything that looks, something to balance my hips.
Now, a nice C could mean a small C, which is conservative, or a full C, which is almost a D, and that's somewhat top-heavy, but maybe acceptable if you have adequate skin for it.
I don't want to be top-heavy.
Good. I may have left something out, so if you have any questions, I'd be
What about this?
Okay.
I hate it in photographs.
Now, what I see here is a combination of some extra skin and a modest, not a large enough, but a modest amount of fat. What I would recommend that we do is with a couple of hidden incisions, tiny incisions here, do a little liposuction. Not only remove some of that fat, but it tends to stimulate some skin shrinkage. So I think there's a relatively good benefit and very small risk in doing that.
So he made me feel very comfortable. He walked in and greeted me, looked me in the eye, all the things that good doctors do. Answered the questions, didn't make me feel intimidated at all. I was very comfortable. He gets an A+ from a nurse. That's pretty good.
Now it's Karen is getting a nose job, a brow lift, the fat removed from her eyelids and chin, and breast implants. This morning, Karen is headed to Beverly Hills for plastic surgery.
I'm not nervous. I know that I'm in good hands.
I'll be glad when the pain's over, then it'll be fun. And I'll be glad to go back home and get married.
Then Dr. Perlman marks Karen for surgery. Dr. Perlman begins Karen's surgery with the breast implants.
And it's done through the little incision in the underarm. The incision will end up being about 1 inch in size.
I like to place the saline-filled implant under the pectoral muscle. Makes it smoother, much more natural looking.
Next is the brow lift.
I'm going to bevel the incision so that it'll help to camouflage the scar once the hair is regrown.
Now Dr. Perlman removes the fat from Karen's chin and eyes.
She'll look much more rested, alert, and younger, more youthful.
Finally, he moves on to her nose.
We're going to be using this cartilage to enhance the shape of her tip. We are done. We've accomplished a lot, and she's going to be very pleased once whatever swelling is present goes away.
1 week after surgery, Karen and Sandra are well enough to travel to Dr. Perlman's office. Today, they will see their new faces uncovered for the first time.
Boy, Well, your neck already looks so much better. I'm really happy with that. I love the new position of your eyebrows as well.
I actually have eyebrows.
Yeah. Very nice. Those incisions are healing well. Look upward. Excellent. When that swelling goes down more, it's going to really be gorgeous.
This is the examination I looked forward to the most because I got to look at my nose. It was the one feature that I have wanted fixed my whole life. I've seen that big nose since I was in the 5th grade.
Peek in the mirror, you can.
I don't know.
You don't have to, but if you want to.
Oh, look at that. It's gone.
I have a print of her picture that we might want to show, the before.
That is so great.
Good. I'm so happy too. And it's just going to look better and better.
It's like looking at someone else. Although you know it's you, it's like looking in the mirror and seeing what you would want to look like if you could. It's a cute nose. Oh, I love it.
Now, Dr. Perlman checks Karen's new breasts.
Great. They're gorgeous. They're gorgeous. Absolutely gorgeous, and not a solitary bruise.
Thank you so much. I'm a girl from the country, and I can't believe that I'm here. I don't know why I was chosen, but it's a wonderful gift, and I appreciate it.
This was Karen Lindley 7 weeks ago before her extreme makeover.
I would love to be a pretty bride. I'd love to walk in there all dutied up and looking 10 years younger.
I wanted to stand beside that handsome groom and be a pretty bride.
Back in Wilson, Arkansas, normal wedding day jitters are magnified by knowing that Blake has no idea what Karen looks like.
My heart rate's probably 150. I'm marrying the man of my dreams, and I get to do it in a beautiful gown, new face and body. I can walk down the aisle knowing that I look the absolute best I ever have in my life.
Finally, it's time for Blake to see his new bride.
I want to give her a big hug and tell her I love her because I miss her a lot.
I can't wait to see the dress. She has described it to me, and it's like an Oscar-winning dress. I can't wait to see it.
Karen's been gone 7 weeks, not that I'm counting. Then when it got down to 100 hours and they'd ask me at the hospital, how long is Karen going to be gone? I'd say 98 hours.
Blake's wait is finally over, and so is everyone else's. The wedding is about to begin.
I'm standing in front of the gazebo, and then all of a sudden she was right there under the ark. And my first instinct was to look around that pretty girl and see where Karen was. But it was obvious real soon that was Karen.
Karen, will you take Blake to be your wedded husband, in sickness and in health, in adversity and in prosperity, and to be true to him so long as you both shall live?
I do.
Well, one of my buddies was here and he's like, you look pretty. And I was like, oh man, when we go to bars and stuff now, they're gonna say, dude, your mom's hot.
I was looking at her, I was so happy for her, she's beautiful. I'm actually jealous now.
Karen had a nose job, brow lift, liposuction under her chin, breast implants, LASIK eye surgery, her teeth whitened, and her hair colored and styled.
Extreme Makeover has made her a beautiful, beautiful woman.
And you'll be flown there courtesy of Air Jamaica.
Many times I've awakened in the middle of the night and thought, why did this happen to me? Things like this don't happen to just a girl from the country. But it's a dream come true. And I am still just the girl from the country.
This is only the beginning for Karen and